My name is Sharon Cooley. I'm a consultant obstetrician and gynaecologist, and I've been afforded the opportunity by Nest to talk to you today about postnatal health. For many of you, that 9-month journey into pregnancy is now over, but for many of you, it's also been more than just the 9 months, but the years that led to this point where you achieved this very much wanted baby. Frequently when you're pregnant, there is lots of support from both family and healthcare professionals to guide you through the pregnancy. And that support is of equal importance, if not more important, now that you're going home as a family with your new baby. The first bit of advice I would always give you is that to be as kind to yourself as a new mum as you are to your family and friends when they become parents. Frequently, as new mums, and particularly first-time mums, we hold ourselves to a higher standard than we do other people. And we go home with the assumption that we're going to do the best at everything for this baby. There is no rule book with this baby. This baby is your baby for a reason. And I need you to actually be kind to yourself, to take time, to regroup when you need to, and to actually prioritise not only your baby's health, but your health. And if that means taking time during the day where you can actually go for a walk or have a nap or have a bath or a shower where you wash and condition your hair, those are equally important as making sure that the baby is fed, the nappy is changed, and that dinner is on the table. So firstly, is to realign your goals. For many of us, this 6 months is the first time in your life where you've had an opportunity to actually spend time in your home with no structure to the day. And baby will dictate that structure. There are going to be days where you're not going to achieve very much. There are going to be days where baby's not in form and you're not in form, and that's perfectly normal. So not to go home with the assumption that you're going to have days where you're going to achieve so much. The goal at the end of every day is that you're well and that baby's well. You're going home from the hospital more than likely with some pain or some bleeding. The pain that you have after delivery is going to depend in some respects on the type of delivery that you've had. Was it a normal vaginal delivery? Was it an assisted vaginal delivery? Or was it a cesarean section? All three of those are associated with pain. For those who achieve a normal delivery, the pain is usually lasts about 2 to 5 days and is usually managed with mild pain relief or over-the-counter pain relief such as paracetamol or ibuprofen. Bear in mind, it took your body 9 months to create space for this baby, and this space now has to be reclaimed by your body as tone and muscle strength builds up. For those that have had an operative vaginal delivery, or even with a vaginal delivery where there's a tear, there may or may not be stitches. And those stitches will gradually disintegrate over the weeks after delivery. And you may notice a little bit of thread on the sanitary pad. That's perfectly normal. The pain with stitches usually is that first week, week and a half. After that time point, if you have an episode where the pain is building, usually it can be a cue from your body to slow things down a little bit. But if you have an episode where the pain is building, or you feel that your pelvic floor, your bottom has some increased swelling on it, touch base with us, because it may be that you have some infection in the stitches, and there is no harm in linking with your healthcare professional, be it your GP, your hospital, your midwife or your public health nurse, to see if you're well and if you're healing well. For those that have a cesarean section, the pain can last a little bit longer, and the stitches and the scar area is usually that bit bigger. So usually while you'll have decent quality pain relief while you're in the hospital, I would ask when you're leaving the hospital that you inquire about pain relief. Do you need a prescription? And if you're getting a prescription, how long is that prescription to last for? Usually if I give a prescription, it's for between 5 and 7 days after you go home. And that's to make sure that you're not at home tired, exhausted, and now being overwhelmed by pain, which is too much to ask of anybody. So do make sure that if you have had a cesarean section and you're leaving the hospital and you're worried about pain, get a prescription for pain relief. And if you're home and it's been a week or 2 after the section and the pain is building at the scar, again, go to your healthcare professional. We would rather see you preemptively where something is starting and that we can address like an infection with antibiotics than to see you come in unwell and require readmission to the hospital service. And again, so it's to seek help early from your healthcare professional. So pain is one of those things that you are to anticipate, but not at a level that's going to give you a disability or limit you significantly when you're home. If you have pain, sometimes it is your body's way of slowing it down. And again, it goes back to realigning your goals. If you have pain and you slow down and the pain eases up, then usually you're asking too much of your body too fast. Exercise is important. But again, there are going to be the days after having a baby typically pass in a blur. So I really just want you to have small walks, and even if only just to get out of the house, because I think the longer you leave it to leave the house when you have a baby, the harder it becomes. Get that half an hour just to leave the house, either with baby for a walk, or sometimes in the evening when your partner comes home, that going for that walk for yourself for 20 minutes, half an hour, is a little bit of headspace, gives you a chance to regroup and gives you a chance to start again. A lot of women worry about, when am I going to get back to a body that was mine? Again, it took you 9 months to create the baby. It could be 9 months before your body's recognisable again. But usually after a few months, we would say after 3 months you can do high impact sports. But after a few months you'll start to see the tone and the muscle build come back into your muscles for you. But again, exercise is important, not only from the point of view of getting back your shape and building tone and strength back into your muscles, but also to relieve stress, to give you a better quality of sleep, and most importantly for your mental health, because this is a huge change in mindset for you, from being a family planning a pregnancy to all of a sudden parents. So build up the exercise gradually. And build it up in the context of plenty of fluid so that you don't end up dehydrated, which is of even more importance if you're breastfeeding. So pain is normal, but disabling pain is not. Bleeding is normal, but usually the bulk of your bleeding will happen over the course of the first 3 to 5 days following delivery. And usually that kind of blood is fresh. It's why we advise people to wear maternity pads, because you need them to cope with the quantity of blood that's coming. After that 3 to 5 days, that bright red blood becomes darker. It becomes brown, and sometimes you find over the weeks after delivery, you'll have lots of ladies who will transition down from the maternity pads to sanitary pads and then to a panty liner. Don't worry if you have a day where you're wearing a panty liner and the bleeding is a little bit heavier and you're back to wearing a sanitary pad again. That's normal. And that bleeding can go on anything from 3 weeks, but I have had ladies come in where it's only stopped a few days at the time of their 6-week postnatal check. If you have bleeding, however, that suddenly becomes heavy, or it's associated with pain, or you're feeling unwell, that isn't normal. And again, as a healthcare professional, I'd much rather see you and make sure that you're okay than see you come in with a heavy bleed, because all of us carry bacteria in our vagina. And some bacteria use the opportunity to dissolve the clots or the seal that is over where the placenta was implanted in your womb and cause a heavy bleed. And then when that happens, that bleed mandates that you really do need medical help. And you do need antibiotics, either in an outpatient or an inpatient setting. So come in, go to your hospital, go to your GP, link with your midwife and link with your public health nurse.